10 years from now, I envision a point where surgeons can directly go on the console, just feed the procedure, hey, perform a robotic cholecystectomy, hey, perform a robotic appendicectomy, hey, perform a fundoplication. And then when that information is fed to the robot, it's going to autonomically integrate with the information provided with its past experiences, and it's going to do the computing, and voila, guess what? It's going to autonomically pneumosufflate the abdomen, and then it's going to work on the most ergonomic spots, and then we have the autonomic port entry.
I see. It's will be the future, really, that you can come directly from your lounge, your medical lounge, directly to the robot, or have the robot in the medical lounge without need to wash your hands or to start with a normal incision. Why we should focus in autonomic surgery? What I mean, it's a lot of effort. It is right now really something that we need?
Exactly, it's a very good question that is asked, Dr. Tony. So the thing is, I think the entire thing about surgery is efficiency. I don't want to compare any surgery with like a performance of an art or like performance of playing tennis or whatever. See, as an audience or viewers or whoever, you want to pay the price for watching the performance. You pay the tickets to see the performance. Well, comparing it to surgery, I feel the performance is actually when you achieve the ergonomic sweet spot after the ports have been introduced for starting a very good surgery. And I feel the economy of movements, and even for the existing robotics, if you probably keep changing your ports again and again, and then maybe give too much of force, machine may crash out because there's too much of energy being involved there. So we need an energy efficient system. Like for example, the basic physics is that you throw something at 45-degree angle, that's where you have the maximum range. I strongly and firmly believe for every movement within a patient's abdomen, there is just one way of doing it the most efficient way. Do you agree?
Yes, I agree. If you have the experience of many surgeons working behind the technology, you should for sure have the best way to put the pneumosufflation, to put the trocars, and maximize the precision of the surgery. I have a question. We have been asked if it's necessary really to be focused in the ergonomics of the surgery. That maybe is not necessary, that there are now no complaints about that. What you can say about that?
Well, the thing is, maybe in a country that is as advanced like US, still from the time of incision until the ergonomic positions are achieved, it may take anywhere between 10 minutes to 20 minutes on an average. Okay, but there are still so many people out in the world, so many surgeons out in the world, where the docking time for robot is, more than half an hour. They struggle anywhere between 20 minutes to even up to 2 hours. And many a times the ports have been removed, have been reintroduced, and there is no efficiency there. And we reduce the increased exposure of anesthesia to the patient. Well, that's where we want to bring in autonomy and artificial intelligence, where we can completely maximize the efficiency of surgery. Without pneumosufflation or without any gas in the abdomen, there is no minimally invasive surgery. Do you agree?
For sure, I agree completely. If there is no pneumosufflation, you don't have a space to work.
Exactly. So without pneumosufflation, there is no minimally invasive surgery. And that is a very strong point that we want to make. And number two, do you feel any other way of doing minimally invasive surgery apart from introducing ports?
Oh, there's no way.
Right.
But definitely not right now.
Exactly. So these are the two constant steps which are always required in the OR. So without the gas in the abdomen and without the ports in the abdomen, we can forget minimally invasive surgery that includes laparoscopy and robotics.
So the company, what is really looking is to be a complete scrubless surgery. What I mean to that is that the surgeon will go directly to the console, start the surgery without worries of starting pneumosufflation, even to don't think about the scrub, to wash their hands, whatever is needed.
Exactly.
Before go to the console, right?
Yes, exactly.
Amazing, sir. Thank you, Sid. I believe that will be the answer if we need the technology. We're talking about safety and efficiency with the current systems. Thank you very much to be our viewers and followers. We should for sure have a next video with more information about SurgeOmniQ-X.